You know, of course, this rubric for situation analysis. And in this video, I'm going to review and examine, do a kind of first pass reading and reflection on an actual situation analysis submitted by these participants. You can see this person is from Afghanistan, is a technical officer who works for WHO. Now, the first thing I would check is in fact this box and the title. So what is this person actually analyzing? It's the measles epidemiological situation and outbreak response. So that's missing an active verb, but it certainly is a good summary of what to expect. So the challenge is measles outbreak response based on the epidemiology in the country. So I'm guessing this has a national focus. And then here is the question that the author is going to try to answer. What are the underlying factors for the frequent measles outbreaks and sporadic cases in the country? And this has been classified under disadvantaged populations. So coverage and equity is the strategic priority. The exact key area of focus can be discussed, debated, but certainly the question is clear, looking for the underlying factors, so implicitly the root causes. Now remember, part one comes last because it's something that you do once you've got all the different pieces of your situation analysis together. So I'm not going to look at that now. I'm going to skip down to part two. And what's important here before you actually begin to read is to review, what does the rubric say? What am I looking for? So first of all, from the ratings, I can see that if there's no challenge or question identified, that's a 0. And at the other end of the scale is if there's a 4, it's an important challenge. There's an important challenge or question identified, supported by compelling explanation of the local situation. Now, review this and then you go back to the work and say, has the person done this? Is there a compelling case? So I can read through this, the National Disease Surveillance and Response System. Okay, first few cases. It doesn't say when, okay, but it does say up to 12th of February. So again, sort of the who, what, when, why, where, and how is what we're looking for about the situation. So a total of 39,000 cases of measles. Now, you may or may not have the expertise to make sense of what these kind of data about measles are telling you. When you do peer review, you'll be sharing your feedback with this participant, and be sure to clarify what is your level of expertise on this specific topic. And you may know nothing about Afghanistan, so also say that. Conversely, if you happen to be working in Afghanistan on measles, the author is going to want to know. But that's not the important thing. What you want to look for is, is this a compelling case? So these are the lab confirmed cases. There's quite a bit actually here. There's a map, which is very good. There's a graph showing the suspected measles cases. There are, I can see, as well as a map. So that looks at first glance quite comprehensive. Again, I'm not going to do a detailed review, just to check the sort of coherence at this stage between what is supposed to be in the situation analysis and how you can determine if that is actually the case. So the question I want to answer is, what are the underlying factors? So where do we get at these underlying factors? Low immunization of measles. So this is really describing the situation. The mean coverage for first dose is 64%. So obviously there's some immunity gaps. The coverage for the first dose of measles vaccine, okay, is 3.1%, 18%, 36%, which makes these provinces highly prone to measles outbreaks. So that is getting at looking at, are there specific regions, specific areas, specific communities? Again, it's all about getting very specific. Malnutrition, okay, other contributing factors. So there's the sort of geographically, where are the outbreaks, where are the breaks in coverage, and then there are other factors. So far, this is a coherent, well-articulated analysis. We'll go back and check what the rubric says. The 4-decade-long war, natural disasters, COVID-19 pandemic, right? So these are all factors. What we're interested in here is, let's go back to the rubric. So introduce where you work, that's already been done. The most important challenge, that's already been done. Turn this challenge into a question, that's been done. That's all in the table, actually. Explain your local situation to help others. So this is someone working at the national level, so it's appropriate for him or her to present country level data. Write down what you need to know. So that is not in the situation analysis itself, but that's part of the process. And then asking the right question, is it important? Is it actionable? Is it appropriate? Is it feasible? So let's go have a look at the question. So what are the underlying factors for the frequent measles outbreaks? Yes, indeed. Yes, if you can identify these underlying factors, that is likely to be helpful in developing actions to address, mitigate, prevent future outbreaks of measles. So here we have highlight what is local, but this is actually a person working at the national level. And then others should be able to clearly understand why answering your question is important. So far, this is pretty convincing. Now, when you do peer review, you'll look at these specific questions in the boxes. So is it clear why the challenge is the right priority and why answering the question could help the author tackle the challenge? I think so. Here we are talking about going to the root causes exactly as intended with this. So, yeah, you could say that why and how would answering your question help you tackle your challenge hasn't been explicitly stated, is implied. So that may be an area for improvement. So now let's go look at, here, remember in the rubric, you have examples of challenges and questions you can ask. So this person, you want to check that the person didn't just copy one of these, but that's obviously not the case here. Now let's go to the data sources. So what you're asked to do here is what data sources you're using for your analysis and why are they the best ones to answer your question. So it's a 0 if no data source is identified or only one. So it's really the importance of having more than one source of data. Now, one important source of data could be your experience or a source of information, but then you need to also recognize its limitations. And at the other end of the scale is excellent identification and comparison of appropriate data sources to answer the question. So now let's see what the author here has done on describing data sources. So 3 parallel surveillance systems are collecting data. Broad but passive data provided by HMIS. Secondly, AFP surveillance, also reporting measles, and then comprehensive valid data provided by the National Disease Surveillance and Response System. This leaves me wanting a little bit more, but yeah, it's an adequate summary, but the health surveys, what's missing here in the data sources, we see it here, is, how can these data help me answer my question? So surveillance data alone, you've talked about the contributing factors. Where do these two meet? How are you comparing? Are some of the data sources more reliable than others? Geographic area, time period, main focus, yes, that's been done. Anything else others need to know? So because I'm not from Afghanistan, I would want to know a little bit more about data reliability, like completeness, timeliness, consistency, reliability, and which ones are more likely to be useful? How do they complement each other? And if they can be used in any way for triangulation. So I would say this one it may be a little short, but certainly if I look at the rubric, and I'm not doing peer review now, I'm just doing a first reading. You should do this first reading. Think about what's in the rubric. Think about the criteria before you start deciding if it's a 0, a 1, a 2, or 3, or 4, and even more importantly, deciding what comments are you going to formulate and give back to the person. So that's really what we want to do here. Now, next we have the key findings. So let's see what's here. Based on the situation analysis of measles epidemiology, overall MCV1 and MCV2 coverage. So yes, I've taken what was presented in the situation and it is below desired levels required to stop measles infection. Now that can seem like stating the obvious given what we know about coverage, but this is carrying out the logical steps of analyzing the situation. Then there are social and economic conditions, so living below the poverty line, malnutrition. What we'd like to know is what are the linkages between these two, but yes, and what are the sources of data for this? We don't see here we're talking about surveillance data. I'd like to know where the information on malnutrition is coming from. It may be obvious or well known for someone in Afghanistan, but at the Ministry of Health, but for readers and peer reviewers, it is not. Moreover, the major challenge, equitable provision. So I haven't seen the relationship between the surveillance data sources and the equity argument. And with respect to high coverage rates, I'd question whether they need to be maintained, given that they haven't been achieved, but it does say achieve and maintain. Inadequate distribution of health facilities. Okay, so this sounds like, yeah, it's unclear to me how the data sources are actually conducive in forming these conclusions. It is likely that this is coming from other experience of the author. In that case, the author should say so and be proud to say that as an expert in the country working in the Ministry of Health, they know, they can assert a number of things that may not need, extensive referencing. So supporting, gaps, various priorities, low community awareness and participation, COVID-19 epidemic, and reprogramming of EPI funds. So we do have some specific guidance on how to think through that particular issue, but this seems to be the measles coverage seems to have been low before COVID. That I guess that could be an important question to look at, and then a data source that would be able to answer that, or the author's experience. Now the analysis has been performed on the secondary data, so it's not clear to me. Is it only surveillance data? Where do these other, arguments, where are they coming from? And in this, inventory of possible, of many different factors, what I'm missing is prioritization. So let me go look at what's in the key findings here. So write down the most likely answer to your question based on your analysis and interpretation of the data. What it feels to me is more of a restatement of the situation rather than, sort of working towards that answer. So you do need to explain why this answer is credible. So in this case, again, I see many different sort of factors or findings, and I'm not sure I understand the logic of concluding that the major challenge is equitable provision of services. So I'm curious to see what happens then in the next steps, because where it all comes together is you use the situation, you use the different data sources to arrive at findings, and these then inform the next steps. So I would like to see sort of explicitly stated the limitations and biases, and then the comparison between data sources is really what we're looking at. Maybe they all say this is the same thing, but if so, then this needs to be stated. Otherwise, we just know that there are different data sources. And then, if the argument, what you're trying to convince me of is that it's an equity issue primarily, or that's the most important aspect to address. I'm not sure I have seen that yet. In this argument, in this paper, in this situation analysis, and then I haven't seen. Well, I guess it's kind of implicit what important information is missing, but that's to be discussed. So before we go back, I want to look at now the next steps. All right, and here, if there are no next steps, that's a 0. And then if they're excellent, now what is an excellent next step? They need to be prioritized, specific, linking actions to outcomes, adapted to the pandemic, fit to the plan at your level, so in this case at the national level, and so on. So let's go back and look at what is in the next steps. Okay, so we'd prefer next steps to be a bullet point or a table. And initially strengthening routine immunization through national, integration of immunization services, right, with food rations. Okay, so there, for example, in this, it's more like recommendations that you would make, to inform a national plan. So I could see this argument very well. Obviously, showing up with vaccines when people are starving, this needs to be addressed. Moreover, planning for periodic intensification 4 times a year. What we don't know is what's currently being done, because then there's a key question of, is there a need for innovation? Because if there have already been periodic intensification, routine immunization for those remote areas, why haven't they worked? Why were they stopped, if that was the case? So those are the kinds of questions. Mop-up or focus district measles outbreak response, to stop measles circulation. So here we run into at this stage, thinking about next steps, this may be in some ways good enough. What I would like to see is more specificity, understanding what is the author's role. What would he or she be recommending these for the person doing the plan? Are they actually responsible for the plan? And then the chronology, like one thing that's missing is a time bound element. We don't know, is this in the next month, 3 months, 6 months, 12 months? Here we have 2 to 3 years, supplemental immunization activities, but how does that fit in with the other aspects? Missed opportunity for vaccination, open vial. Okay. So this is a good inventory. What I'm missing maybe is the prioritization. So if we go to the rubric, first item is prioritized. Which ones are the most likely to help you make a difference? Because for this author, we're going to ask them to actually then develop the action plan around this challenge. And then, so probably at this stage, what's important is a situation analysis. I've pointed out some things that I would have liked to see more of, but it's certainly a coherent attempt. The author obviously knows what they're talking about. In some cases, we're missing references, like to validate that they do know, but it certainly sounds like it. And the next steps, I would say, some of them are generic, obviously in a difficult context. So maybe this is actually not in the rubric, but thinking about the barriers that would prevent some of these next steps from being implemented. And then just one wonderful thing is that this author has actually taken the care and the time to reference the actual ideas from the ideas engine that have inspired them in writing their own plan. Now, we don't know exactly how. There's a reference to missed opportunities here, which appears in the next steps. There's the reduction of 0 dose. So that may have to do with reaching remote areas and so on. But this person has done a very good job of documenting from the ideas engine. I don't think so. There are some references in the text itself. What's wonderful, again, is having those visuals, having the map, having the suspected measles cases and measles deaths, suspected deaths in the figure, having that sort of country map showing the distributions, showing some regions are more affected than others. And now let's look at the cover note, last but not least. Once you have the sort of overview of what should be, what the plan is about, what's in the situation analysis, then you can go back to this. And all right, so this is a short note to your supervisor or leadership team, and so you want to help them make sense of the most important findings, understand the proposed next steps, and state what support you need. So let's see if this person has done this. So I don't see the support needed. I don't see the prioritization, which I think is the Achilles heel of this project. Conduct outbreak response in those high-hit villages. Yeah, so this is, again, summarizing the next steps, sure. But, I would recap, basically one sentence about the situation. There are measles outbreaks. There shouldn't be. There are suspected deaths. Second, here is, in a way, the missing link is what do I think as the author are the most important causes? What's the root cause of the problem? And then present the actions that, the most important actions, and prioritize, explain which one is the priority and why. So I think, the cover note would definitely need additional work. But overall, fairly complete, coherent, well-developed project with the author's experience showing through. And we haven't gotten to the peer review stage yet, so I might just record another tutorial explaining how I would review and what peer review, what comments I would feed back to the author. This is my own internal commentary. Then I would try to be very constructive and as helpful as I can to this author so that I can help them make specific targeted improvements to make their situation analysis even better so that when it comes time to developing an action plan, they have something really robust, really solid to build on.